Just because you know what's going on and maybe you've done a little treatment, there's still a whole world of stuff that you probably need to follow through with in order for all of this to stick.
Yeah.
For a person who's suffering, if you've been hospitalized or you've got something that you guys would identify, say, as a primary substance use condition, and that's been identified, we know for a fact that a year of sobriety might buy you 2. If you can put in a year, you might have bought yourself another one. If you can put in 2, you might have bought 5.
Right.
But sobriety is a lifelong process.
Yep.
It's not just about sobriety. It's about like self-care and self-knowing and identifying things that cause you to seek out this numbing thing that you've done with your life or cause trouble. If it's a mental illness, if this big, the ugly head of a mental illness starts to rear its head, and I don't even know what that is. The person had psychotic features. They had, severe depression, or they had all this impulse control stuff. It's like, what do we do with that? It's like, well, you don't turn on, it's not like breaking a leg. It's a long-term condition. We're going to have to go for, 6 months, a year, 2 years worth of various levels of care.
Good afternoon. My name is Graham Durgee, and I am the founder and CEO of New Waters Recovery in Raleigh, North Carolina. Welcome to Finding New Waters. I'm joined today by our Director of Admissions and Outreach, B. Reeves, and Todd Weatherly, Managing Partner at Stucker, Smith & Weatherly. Todd is a pioneer and leader with over 25 years of experience in the field of health and human services. He is passionate about building programs, creating community, and helping families, a career driven by his deep commitment to serving others. As a former treatment program executive director and CEO, he is a widely sought advisor throughout the treatment community. He is focused as a mental health and substance use treatment and program consultant for over a decade and is a qualified mental health and substance abuse prevention professional. Our goal in creating Finding New Waters is to provide a resource for families to help navigate the complexities of supporting a loved one struggling with substance use or mental health. When we find ourselves in crisis due to one of these issues, most people have no idea where to turn. We hope to shed some light onto what is often the darkest hour for many families. Todd, thanks for being here today, buddy.
Thanks for having me. I'd like to add to that little bit you did about me. Thank you. That was very nice. That I'm really just a guy.
Really just a guy.
Just a guy.
Yeah. 100%. Right. And I think we're all, we're obviously all working in this field and kind of doing God's work here. And, the reality is that a lot of us are in this work because we've struggled with these things in our own lives. Right. Absolutely. I'd love to get into this a little bit today. And obviously the real goal, as I kind of stated there, is to provide resources for families to help them navigate the complexities of dealing with substance use disorder or any mental health conditions. You are a therapeutic consultant, and I think that for a lot of people, they don't even really know what a therapeutic consultant is. So I'd love for you to kind of dig into that a little bit and kind of explain kind of what you do for your career.
Absolutely. And a lot of the families that end up finding us and calling me are like, I didn't know you existed. I wish I had known about this several years ago or when we started this journey, because what they've done is, ended up in a crisis, maybe ended up in a hospital. And then after that, it's like, well, we're just going to follow the advice of the people that gave us this care for 3 days.
Right.
And, their version of that is just, some outpatient, some whatever. We know that that's not enough for folks. Yeah. Hospitals are largely Band-Aids. They'll get a person to where they're not a harm to themselves or others. There's the criterion, right? And then after that, you're good to go, except you're not good to go. Yeah. And then you walk out into this world where, what kind of program do I have? Heck, what kind of illness are we dealing with? I don't even feel clear. They've handed me a discharge summary that's 2 pages long. It's got a couple of words I don't really understand, or it's using terminology that I'm not familiar with. I go look it up on the internet. And it's like, oh my gosh, it's like, well, do I need PHP or IOP? Does they need residential care? What kind of residential care? Are they, all of a sudden they're faced with this mass of material, this undifferentiated mass of how to care for, mental illness or co-occurring substance use disorder, and they don't know where to turn.
Yeah.
Some people try to do it on their own. And when they do that, they hit the Google consultant and try to figure things out. And they end up spending a lot of money, a lot of time, misdiagnoses, treatment after treatment, hospitalizations, all these other pieces that they see that ultimately don't work or are not, designed or a good fit for the person who's needing care. And they get a year, 2 years down the road, and they're still no better off.
Right.
And so a therapeutic consultant, of course, is, last year I toured 70 programs. I still feel like I still run into new programs. I still wow, there's a whole series of programs in this area I didn't know about.
Right.
I can't imagine. I've been in the field for 25 years. I can't imagine being a family faced with it and then all of a sudden having to go, okay, now I'm going to make myself an expert.
Right.
If you find someone who can be a guide, you don't go into a courtroom without an attorney,
right,
because you don't know the law.
Right.
Unfortunately, we don't have a user-friendly system unless they come to places like New Waters where people are very friendly and very accommodating and know what they're talking about.
Right.
If they happen to be lucky enough to find a resource like yours, awesome.
Right.
But otherwise, they're turning to this massive material and language and everything else that they don't know how to manage. And if they come to they come to a therapeutic consultant, like any member of our team, or there's not a lot of therapeutic consultants out there, but there are a few. If you happen to find a good one, they can help you identify things, navigate the system, figure out that, hey, just because you know what's going on and maybe you've done a little treatment, there's still a whole world of stuff that you probably need to follow through with in order for all of this to stick.
Yeah.
For a person who's if you've been hospitalized or you've got something that you guys would identify, say, as a primary substance use condition, and that's been identified, we know for a fact that a year of sobriety might buy you 2. If you can put in a year, you might have bought yourself another one. If you can put in 2, you might have bought 5.
Right.
But sobriety is a lifelong process.
Yep.
It's not just about sobriety. It's about self-care and self-knowing and identifying things that cause you to seek out this numbing thing that you've done with your life or cause trouble. If it's a mental illness, if this big, the ugly head of a mental illness starts to rear its head, and I don't even know what that is. The person had psychotic features. They had, severe depression, or they had all this impulse control stuff. It's like, what do we do with that? It's like, well, you don't turn on. It's not like breaking a leg. It's a long-term condition. We're going to have to go for, 6 months, a year, 2 years worth of various levels of care.
Yeah.
People don't even know. They don't even know that fact
Right.
when they go into it.
Right.
So,
yeah, they think that they're going to send their loved one away. It's going to be a 30-day, quick fix, and we're going to fix them, and they're going to come back a different human being, right?
Right.
And that's obviously not the reality.
Right.
For
they are not a car needing a new carburetor.
100%.
Right.
Right. No, and it's interesting because we, I think in general we've seen this over the last kind of 6 to 7 years, where we've started to see a ton of, especially young adults too, who have been in treatment 6, 7, 10, 12 times.
Right.
Before the age of 30, and that's concerning. Obviously, we're missing something there, right? And that was really why we started, this assessment track to begin with at New Waters, was because, again, we were missing so much, right? And I think there was a lot of underlying issues that weren't being addressed or identified, whether it was, possibly autism, OCD, thought disorders, and any kind of litany of things. And, we just keep sending them down the same pipe and sending them to, a primary substance use program that's just not hitting the mark, right? And so, I think that you're right. And I guess you hit on something there I wanted to pin on is, you said if you get hooked up with a good educational or therapeutic consultant, what, in your opinion, what's the difference between a good and a bad or less than? What would you be, if somebody was out there looking for a therapeutic consultant, what would you recommend that the top 5 questions that they would ask?
Well, and sometimes I get families ask some of these. So I belong to an organization called the Therapeutic Consulting Association. If you go to their website, you'll find a very long document of ethical guidelines for therapeutic consultants.
Right.
So we're not going to read that, but no person who's behaving or claims to be a consultant should be getting money from programs. They should be getting kickbacks. This This, they're serving their clients. Being an independent consultant means that you're not tied to any specific program, or, in the pocket of any particular program, which happens.
Yep.
You've even got programs that will offer to pay consultants for referrals. And it's like, I've had them. I'm like, yeah, no.
You're like,
So-
won't be sending here anymore.
Yeah. It's like, well, it sounds like you're sending me here. Are you getting paid by these guys? It's like, it's a fair question and you should ask it.
Yeah.
Absolutely. The other piece is, if you've got a consultant that's not out traveling, that's not meeting with programs and seeing places and getting around the country, for the TCA, we're required to visit at least 40 new programs per year. We can have a few of those be a recycle or a revisit, but generally speaking, we're out there finding new programs that we haven't been to, so that we can, broaden our scope of understanding of the field and what treatment is like out there. Because not only do you run into new places, which is great, but you also, places change.
Yeah.
We were talking earlier a little bit about wilderness programs. It's like, is wilderness work? And it's like, well, there are good wilderness programs, and then there are wilderness programs that ran into trouble of some kind and they closed.
Right.
There are programs across the board that maybe they changed leadership, or maybe they just changed clinical model,
Yeah.
or maybe they changed something, and it's like, there are some nuances here I want to be familiar with before I send my client there, because I want to know who the right client is. So you also want to, it's not necessary. I say this because I'm not a licensed clinician. I've got other qualifications, but I've been in the field for a very long time. Look for organizations they belong to. Look for social media presence or web presence that demonstrates that they're out there doing the work.
I would even say too, which I love, is talking to an alumni family.
Oh yeah,
Right?
absolutely.
It's like, listen, hook me up with 3 alumni families that I can talk to, and and let's see kind of what their feedback is. Now, they're going to give you people that obviously had a good experience with them, but
Right.
you can, get a good feel for it, right?
I had that come up, and I gave a client, a former client, their adult child. They didn't end up going to treatment because they were very hesitant and they had a lot of issues that were kind of moving the needle along was difficult for them. But we were a resource for the family. They had a plan when he was ready to kind of take that help and everything else. And even though we got through it, I still heard from the family, they were a referral for us, and they are a reference. And when the reference calls, it's like, why did you give me a family where the person didn't actually go to treatment? I was like, we don't know the end of his story yet. This family has gone through a long process, and we've just been guides through that process. He knows where to go. They've got the resources for being able to find what they need when he's ready. But everybody reaches ready on their own speed. And so not pushing a person and really listening to them and waiting for them to be ready, even if it's not inside of this service agreement time frame, is really important. And they were like, that sounds really reasonable to me. So anyway,
Yeah, 100%.
I've got a question. What the terms educational consultant and therapeutic consultant seem to be somewhat interchangeable, but clearly there's a difference in the.
And then you've got educational therapeutic consultant.
Right. Can you just shed some light on that for everybody who probably has wondered that as well?
So Ed Consultant was born out of, I want to get my kid into
Boarding school.
the top boarding school or the top college, or both. And then you had, that started off a long time ago. And
Same kids had
in
to
the
go to rehab.
Northeast. Yeah, in the
Right.
Northeast, right?
And then, suddenly it was like, my kid before they go to boarding school is going to need treatment, or they're having problems, and then the treatment field started to expand, but the Ed Consultant stuck because when you were sending them to maybe you're sending to a boarding school, or in this case, a therapeutic boarding school, you needed a person who was able to review, are they having reading issues? What does their WACE say?
Yeah.
What is their full scale IQ?
The master's in education.
How does it match up to a treatment program that's going to help them address, say, dyslexia, for example, or dysgraphia? And so you had all of that coming in, and then I think as time went on, we could probably speak about this for a while, but we just started seeing. Kids and young adults got more and more complex. They had more and more complex conditions, and their conditions were complex enough. It's like, forget school. We got to focus on treatment. You know, we're gonna drop academics for a little while, and we're gonna help this person get well.
Do you think these? Sorry to interrupt you. But do you think the kids have gotten more complex, or do you think that there are more labels to put on the same type of kid?
I might ask that question of you too. I think we've got more words, and I think we've got more capability to treat and evaluate. The other piece, though, is that we still don't have a functional mental health system.
Mm-hmm.
It doesn't exist in the school systems, by and large. It does not exist in the colleges, by and large. Colleges they are very resistant, even admitting that there's a mental health or substance abuse problem on their campus,
Right.
as we all know. And so what you end up with is you kick the can down the road, and a person, if they had been treated when they started having problems, could have been pretty well off.
Yeah.
Except now they're however far down the road, and this condition has gotten much worse. And then you've got the whole parenting equation. I mean, we see we all see trauma, just some of the worst trauma that you can kind of imagine coming out of family scenarios or even school bullying scenarios or what have you. And trauma just...
Yeah, it's absolutely insane.
It puts a hurt on
what these
people.
kids are dealing with now. And then social media and,
I was going to say,
all the
social
things
media.
that are coming at them. It's, and obviously I have 3 daughters myself, and it's, they're very young, and we're already starting to have these conversations and navigate it. And, you see them, they just get so attached to it and addicted to the screen. Right.
Right.
So, now, sorry, I had something, and I just totally lost my train of thought on that.
Trauma, I've heard it said since I've been in this field that trauma is the real gateway drug. You heard that? Agree with that? What are your thoughts?
Trauma's the gateway drug. I haven't heard
the real gateway drug.
I agree with that. I think that it's rare that you can work with someone who's struggling with a level of condition that requires the kind of intervention you guys provide or needs residential care that doesn't have some trauma in their background.
Yeah.
Yep. Either it's as a result of their drug use, or it was, it's what incited their drug use,
Right.
for example, and, co-occurring mental illness and all the other pieces. Trauma's there. Yeah. Resiliency is there's a resiliency model. Some schools are trying to use it, but like, why in the animal, like they point at zebras. It's like, you see this zebra crossing a river, and it's like, and a crocodile tries to eat it, and something else, and it just kind of kicks it off and shakes it off and keeps going. It's like, how do we do that? How do we pick that back up as people living in a world that we do? That's a good question. I think there's good programming for it, but we could use a little more.
What have you seen? So on the subject of social media and trauma and bullying and all that, you've been doing this long enough to see the real rise of social media just taking over everyone's lives. Has it just been, what's it been like to see that in your world?
Well, Graham says it, you got kids getting access to phones and devices like very early on. They're the substitute babysitter, and so the problem is that it's everything at once. It's like I need some water, so I'm going to put my mouth to a fire hose, and somebody's going to turn it on full blast. Like that's what, I'm a Gen Xer, so I grew up. We didn't have phones, we didn't have screens. You waited for your show to come on between this time and this time, and I just don't have the same draw to being obsessed with my phone that I see young adults having.
Well, I've read something actually funny enough today, and I was talking about how kids today, and really the phones and the screens and all of that are becoming such an issue because kids today have no idea how to be bored, right? And like being bored is a good thing for a kid because it makes them go outside and play and use their imagination and, try to, just figure things out, right? Rather than, that instant gratification of always being entertained and constant, screen time. And I think that's really becoming that's part of like this whole thing that's happening with social media. And I don't even think we have a real grasp on how detrimental this is going to be to our society at this point. But,
Yeah.
we're certainly seeing a lot of it in the behavioral health field. And I even think too that, there's going to be a real market down the road for, technology addiction, and
Yeah.
I think that these treatment programs, need to start, trying to figure out how we're going to start treating this technology addiction, because it's just,
Well, they're out there already. In
Yeah.
fact, there's a program in the area where I am, Foundations Asheville. They actually own the phones. So kids come out of treatment, they go into this transitional living program.
Interesting.
They own the phone. It's got limited access. They monitor everything that's going on it. It's got some social media on it because they want them to practice, but they also are like, okay, did you feel triggered by any of these things today? How long did you were only allowed to be on the phone for this long? And then they work their way to getting their phone back.
Yeah.
And I'm, like, yeah.
That's awesome. So what, and that place is called what?
Foundations Asheville is part of the Trails Carolina Trails Momentum family of programs.
Very cool.
Yep.
Yeah.
We were at a conference together. Yeah, we were at Montreat, or no, not Montreat, but I won't name the conference actually. But
Oh, the young adult conference, right?
yes,
Mhm.
and they I sat in a session, and I think we were just talking about the guy who was the speaker, and they were talking about the ramifications of the therapeutic boarding schools and the Paris Hilton stuff, and they were the topic was what would be the next thing that would be considered abusive, and they were saying that they were afraid that taking kids' phones from them now would be considered abuse in 10 years, because it'd be like tantamount to chopping their hand off.
Yeah.
And that's the fear, that that these kids are so addicted to their phones that not having them is considered abuse.
And there's no and they have no tolerance for the distress.
Right.
Right.
Yeah. Yeah, that's a scary thought.
Yeah.
So
Yeah, it is. And, it's certainly, we're doing the best that we can to try to like manage those things at home, and obviously working in the field, and dealing with these things and seeing these behaviors is always, you try to bring this stuff home and implement it in your life, but it's not easy, it really isn't. And I wanted to go back and talk about, you were talking a little bit earlier about touring programs, visiting programs, and the importance of all that. And that kind of brought something up for me too, because I know when here with our team and our continuing care team, we really look at the program, but not only the program, but a lot of times like who's the clinical team, right?
right.
And I think that is something that most places don't do, but we really need to start getting very granular on how we're referring our patients,
Right.
because if you're just sending a client to a program that's a good program, it's really it's throwing darts at the dartboard on what therapist you're going to get, and you don't know what that fit's going to be like, and that could be that could be hit or miss on whether the program works, right?
Yeah.
So talk a little bit about that, and
Well, yeah, I mean, there's the ones. It's not a school of thought. I mean, it's something that a study that came out. It's not the they took 5 different treatment models, and they tried to measure the efficacy of the treatment models, and they all came out about the same. And they found that the factor that made the determination as to whether or not the treatment model was successful was the provider.
Yep.
Was like being able to build rapport and having a trusting relationship and those kinds of things. I think a lot of that centers around a good leadership team and a good clinical director.
Mm-hmm.
You might, you're throwing darts at a dartboard for which therapist you're going to get. But, for me, if I'm placing a client, I'm sure this is true for you, that's great. I love that you've got nice buildings and pillows on the couches. But can I talk to your clinical director for a
100%.
second? And if what I hear from that person is a person who knows how to look at the client that I'm sending to them and go, you know what, I think this person's going to have a personality match with, the new therapist that I just hired, or this therapist who's just, old hand at this particular condition or whatever it is, or is really good at this particular practice or methodology, and can really place and work a team and knows how to, manage a milieu, the treatment environment that way. That's what I'm looking for out of a program. And I'm looking for the relationship. I'm looking for somebody who can talk to me, and we can kind of get to the nitty gritty for a minute, and we can whittle it down in fairly short order to make sure that we are a good match, and then continue that conversation as the person receives treatment. That's That's what a consultant should be doing for you.
Right.
And then turn around and give it to the family. Maybe I'm jumping in on the call, or I'm turning around and saying, in several of my families now, they're like, even though they've been kind of through the ringer,
Yeah.
they still feel unclear about how does this process go and
Yeah.
what does this mean?
Right.
And, what should we expect next? And all these other things. It's like they still, even 3 years worth of being through it with their adult child, and they still are uncertain as to what, like, 2 days from now is supposed to look like.
Right.
So we have a lot of phone calls. It's like,
Right.
okay, we're doing all right. Looks good so far. We're still early in.
Right. Yeah. 100%.
And we got to be patient,
Yeah. Yeah. And from like a treatment provider perspective, I mean, having somebody like you in the mix is amazing because, you're doing such great work with the family, right? And
that you know of.
I listen, we worked on clients together before. I know this for a fact. So, but I think that obviously that's important to us as the providers because we're kind of on the front end and we're handling the client, and sometimes that takes a lot, right? So when you throw the family into the mix, if we have a little support from somebody like you. And obviously, you have a ton of background. I've been working with the family for X amount of months. It's a huge benefit to us. So
yeah, they're not blowing up the program trying to figure out what's going on. I mean, like, they've got somebody they can go to when they're nervous, and
right,
because they're often nervous and rightfully so.
And they don't know that this is not just as we said earlier, like you're not sending your kid away to get fixed,
right?
Mm-hmm. You're going to be doing work too. This is a family disease. Everybody's got some buy-in here, and everybody's going to have to kind of do some changing.
Absolutely, yeah.
What do you ask families typically to do in terms of keeping their side of the street clean?
A lot of I think I don't want a family to feel like they shouldn't ask for information or feel like they know what's going on. I think that's legitimate that a family wants to know that, but it's the contact with their child. Adolescent or young adult or adult, like, can I call them every day? It's like, no. I want them to turn to the program.
Right.
I want them, they're using you as
let them fly.
Let them fly. Like,
right.
They're using you as a comfort right now.
Yeah.
I want them to turn to somebody else to follow the program, engage in the program, start getting benefit from the clinical care that you are paying for. Mm-hmm. So if they turn to you and you're calling them all the time, and that's there are some programs that take phones, and then there are others where it's kind of freely available. Depends on where you go. If they're doing this call all the time, I'm like, well, maybe we should one call, possibly two at a certain time, and only for this long.
Right.
So setting limits around that is one of the big things that is important.
Mm-hmm.
Why? So from what I know, consultants seem to work with teenagers and young adults, and then is there a need, or do you work with adults, functioning adults who are maybe kids? Does that ever happen?
Well, I think we were talking about what makes a good consultant, and part of it is also I have a team, so I have myself and 3 other individuals who work in my practice. So each one of them has a bit of a specialty. Like if I feel like I'm out of my bandwidth here, I'll call one of my people and say, hey, why don't you pick up this case, because you've got either a connection to a program that's going to serve them, or a connection to the condition that they're struggling with, and feel like you can talk to the family. So we're doing personality matches as well. I think that you find consultants who will kind of take business when it shows up. Mm-hmm. That happens. 12, 13, like child therapeutic placement, 0 to 11, 10, 11, its own bag.
Yep.
Mm-hmm.
I have to refer all those out.
Right.
I refer most of the up to 16 out. Mm-hmm. Because 13, 14, also its own bag. Mm-hmm. It's a whole world unto itself. Mm. There's educational evaluation. The programs are different. So if I'm in the stream of visiting young adult and adult programs, I'm not picking up these therapeutic boarding schools and treatment programs for that age group.
Right.
And then even young adult is kind of its own world. Mm. There's a strong chord of young adult treatment out there. Right. And you can go to wilderness, or you can go to residential treatment, facility-based residential treatment, or assessment center, or I mean, there's the wide variety.
Right.
And then where you start running out, and this is part of what, our practice we do is we're actually one of the few that serves older adults. So I've got 25 to 30% of our client base is over the age of 40.
No way. Wow, I didn't know that.
So 40, 50, I've got a 70-year-old.
Wow.
And they need to stabilize their own meds. They need to stabilize with a substance use condition. You guys may be seeing one soon. And so, these are people that they've been through lots of treatments or hospitalizations, or they've fallen off of maybe a medication has been working, or they've stopped taking one because it was making them feel weird. And all of a sudden they're symptomatic, and they've gotten really, the brain at 40 looks different than the brain at 20 and 15. You know what I mean? It's a whole new ball game when you start doing that, and their treatment options are less.
Right.
So, for a good consultant's going to be able to know what their bandwidth is, and stay with their wheelhouse. If you came to me with somebody, regardless of their age, and they were on the spectrum, ASD2, pretty severe symptoms and condition, it's not my wheelhouse. I know some people who really specialize in autism spectrum disorder, and I'm like, hey man, you gotta get room for a client because this is not my wheelhouse. And being able to say that and refer out and go to people that you know or have got skills in the area where they need to be in order to serve that client and pass off clients and have a network of people that you can pass clients off to. That's another reflection of a good consultant.
That's awesome.
So you might not know that if you're a family, like you wouldn't know the ins and outs of my practice, but like being able to refer out and know what your wheelhouse is important.
100%. Yeah. And I mean, it's just ethical.
It's ethical.
It's just
right.
ethical.
It's ethical.
And that's what we need to do. And obviously not everybody does do that, unfortunately, but I think that it's important that, families know that there's this internal network really of people like yourself who all work together and are very well connected and know what each other's specialties are and all that. So I really do feel like, families, if you do need resources like this, please reach out to, Todd and, just ask him for resources or just bend his ear. Because we all are constantly taking these phone calls and just trying to kind of help navigate families to the best resources. And a lot of times it's not us. And that's what we do is get them to the right place. Right.
First phone call's free.
Yeah.
We'll talk as long as you need.
That's right. That's right.
Don't use the Google consultant.
Exactly. So, we'll end the episode, but today, and wanted to just say thank you to Todd so much for coming in today.
Thank you guys. Thank you.
Please visit our website at www.findingnewwaters.com, where you'll see all of our episodes up there. Like, subscribe, also on all streaming platforms. And we'll have Todd's information up on the website as well. And thank you all for joining us today.
Thank you so much for having me, B.
Yeah, man. Thank
Graham.
you.
Thanks, guys.
Thank you.